You want to know how to prevent HIV? Get prepped. I'm Dr. Patrick Johnson from Access Health Louisiana. As a physician who specializes in primary care and has been treating patients for years who are diagnosed with a variety of conditions, including sexually transmitted infections, I'm here to talk to you about preventing human immunodeficiency virus, better known as HIV. Yep, you heard that correctly. I said preventing HIV. It wasn't long ago that we didn't have a way to prevent HIV infections, but thanks to amazing advances in medications, we now can. As you likely know, today HIV is treatable, but still not curable. While contracting HIV today does not result in the outcomes the diagnosis meant decades ago, individuals at high risk for contracting HIV now have a way to avoid getting infected altogether. A medicine called PrEP, which is short for pre-exposure prophylaxis, is available to help HIV prevention. So you might wonder if you're a candidate to take PrEP. Well, ask yourself a few questions. Are you currently HIV negative? Do you worry about contracting HIV from injecting drugs or having sex? Do you consider yourself at high risk for potentially contracting HIV? If the answer is yes to any of these questions, then you are a candidate for PrEP. While PrEP taken as prescribed is 99% effective, it's important to distinguish that it isn't a way to protect yourself from other sexually transmitted diseases or from hepatitis C, which is also associated with intravenous drug use. But keep this important fact in the forefront of your mind. PrEP is specific to preventing HIV only. When taking PrEP, you still need to be tested regularly for other STIs.
Hey buddy, I wanted to let you know that Stuart tested positive for HIV.
Really? Is he gonna be okay? And I know you two just started going out. Are you okay?
Yeah. Luckily, he got started on HIV meds right away, and he'll have to take them without fail every day for the rest of his life. But essentially, he'll be fine. But as soon as he told me, I went straight to the doctor's office to get tested for HIV. Obviously, I had to find out, and I'm HIV negative. Since I'm negative, I can start on a medication that will prevent me from getting HIV called PrEP. I mean, Stuart will eventually get to a point where he can't transmit it to me. But until then, I'm going to protect myself with a medication called PrEP. Stuart's new medication should kick in a few months to reduce his viral load to a point to where he can't transmit it to me. So he's going to be fine. And by taking PrEP in the meantime, I'll be fine too.
Well, when he's unable to pass it along to you, are you gonna keep taking PrEP?
Well, he'll be tested again in a few months, allowing time for his HIV medication to do its job to diminish the infection. And once that blood test comes back that the virus is undetectable, he will automatically be unable to pass it on to me. I'll take PrEP until that time. After he's untransmittable, I can go off on it anytime. Of course, if something happens and we break it off, I'll get back on PrEP before I jump on any dating apps. I mean, now that I know about it, it would be dumb not to protect myself.
Yeah, honestly, I don't know too much about PrEP. I mean, I saw an ad for it on Grindr, but I didn't pay too much attention to it. But man, since I'm on the market now, and before I hook up with another guy, maybe I should get on PrEP.
Yeah, good idea, man. Just know, you will need to get an HIV test first to make sure that you're HIV negative. If you are, then yeah, man, I suggest you start PrEP. That was the part of the reason I wanted to let you know. I know you're dating both Doug and Ron for a while, so I just wanted you to be aware.
Thanks, man. You're a really good friend.
Anytime, man. Hey, Dr. Johnson. I can't believe it's been a couple of months since I started on PrEP. I'm almost out of pills.
Hi, Pete. Well, it sounds like you're taking them daily, which is great. Let's do an STI screening on you to make sure everything else looks good, and then I'll refill your PrEP.
Okay, so this time, can you give me a prescription that lasts longer than a couple of months? That's much more convenient for me.
Well, Pete, it's important that we follow the standard of care with PrEP. The reason we get you in here to give you a refill is because we want to make sure that you don't have something else going on. That's why we are checking your lab work. We want to be sure you haven't contracted something like syphilis or another STI. Remember, PrEP is specific to HIV prevention only. It's not going to protect you from anything else.
Yeah, I guess. I mean, I try to use a condom when I can, so I'm feeling pretty safe. And I know I can't get HIV, so that's what motivates me, honestly, to be good at taking PrEP every day.
And I appreciate that for the most part you are being careful. But since you're on top of HIV prevention, it's important to be as vigilant with the other STIs out there. And don't be so quick to dismiss the other STIs. While we can treat them, they aren't something you want to get and spread to others. Let's face it, PrEP is a cool way to prevent a lifelong infection that wasn't preventable just a few years ago. The problem is that more people need to know about it and take it. It is essential if you're at high risk for HIV infection or if you inject drugs. And while men having sex with men are at the highest risk of getting HIV, I don't want to discourage women from taking PrEP who feel that they are at high risk. But remember, the #1 thing to do is get screened and know your HIV status as well as the status of other STIs. Getting prescribed PrEP is easy and it's covered by insurance, so there's no barrier there. Plus, when you are on PrEP, you will see your doctor regularly to be screened so they can authorize refills on your PrEP. Of course, combining PrEP use with condoms will reduce your risk of getting other STIs. We've come a long way in treating, managing, and now preventing HIV infections. So do your part and don't hesitate to come in for an exam and get a PrEP prescription. And spread the word like Pete did with his best friend Jay. More people on PrEP means less HIV. At Access Health Louisiana, we make it easy for you to prevent HIV and take charge of your sexual health. There's lots of right choices to stay healthy, and we're here to help you make them.